Well, good afternoon. My clock is showing just afternoon now, 12 o'clock. And I hope that many of you were able to join us watching Seniors Day presentation through the CARP website or YouTube. So for those of you joining us from the national webinar, and the theme was long-term care. And I hope that you found the information interesting, if rather sad. As it is the International Day of the Older Person, today we're talking about the need for a seniors advocate. What is that? Why is it needed? And what the next steps are. So with that, I would like to welcome you to the CARP Prairie Regional Webinar. This is members from Alberta, Saskatchewan and Manitoba coming together in a joint effort. And we're looking at the need for a seniors advocate in each of our 3 provinces. If you're joining us through Zoom, you'll see the questions and answer function. If you could add your questions into that as we go along, I will pick them up and we'll answer them. We'll ask the panel at the end. Feel free to use the chat function. That's something we've really enjoyed. If people say their name or even kind of where they are, it's great to have a feeling for who's joining us. Some people have even elaborated on like why they're joining or what their occupation is, why they're kind of interested. So at the end of the presentation, we are going to have some links to the Facebook pages, the Facebook sites for the 3 provinces, and there will be a summary of the presentation posted there. So today we have Peter from Manitoba, Kathleen from Saskatchewan, and Doug from Alberta. And I'm going to hand over to Doug to run through the presentation. So I'm not hearing Doug at the moment.
How about now?
I can hear you now.
Sounds great, Doug.
Okay, sorry about that. Lovely technology. So I am going to be using some examples from the former seniors advocate we had in Alberta. It was in place from 2016 to 2019, but currently Alberta doesn't have a seniors advocate. So these are some of the things that we're going to be looking for out of a seniors advocate. Identifying and resolving issues of concerns to seniors. So in Alberta, a senior was facing eviction from a social housing unit because an adult child moved in to support the senior, but this violated the rules of the lease. So the Office of the Seniors Advocate was able to work with the housing association so the senior didn't have to move. Policies and programs affecting seniors. Again, from Alberta, the Seniors Advocate was able to clarify the registration process for Blue Cross coverage for seniors. They also recommended
Excuse me, Doug, can you adjust your screen share, please?
Adjust it how?
Because I'm seeing only a portion of your screen.
Oh, I'm seeing the whole thing here.
Okay, sorry. I'm sorry. It's me then. Sorry.
Well, thank God it's not just me that struggles with technology.
Okay. So systemic decisions about seniors. So these can range anywhere from ageism, dementia care, income supports, and others. Providing information to the government regarding seniors. Again, the Alberta Seniors Advocate did report to government on the issues we just talked about, which is ageism, dementia care, income supports, and barriers to finding and accessing information utilizing government programs. I'm going to talk about these 2 topics together. Again, the Alberta Seniors Advocate gave 44 educational presentations, 9 sessions on aging, and 35 presentations about the office. They also met with 60 seniors and stakeholder groups and appeared in the media 23 times. The last point here would be something new within senior advocates across Canada would be to try and work together to learn from each province on the best care and bringing support to seniors across Canada. What we're looking for the mandate, and there are a couple of seniors advocate offices in Canada, and they're not all consistent. But what we feel is that it needs to be twofold. The first one is that it has to be able to champion the causes of individual seniors that aren't getting what they need out of government programs. The second part is to affect systemic change in government policies, legislations, and programs so that better support is for all the senior population. We're going to get into a little bit of how it's actually established and why it needs to be independent and established through legislation. As a prime example, the Seniors Advocate in Alberta was put in place through what was called a ministerial order. This means the advocate reported into the ministry and housing and took direction from that ministry. It also means that a new government or an existing government can simply not renew the order or just cancel the order, which is what happened in Alberta. So this is a reason why we're adamant that the Seniors Advocate be put in place via legislation that's much harder to change or cancel. So legislation enshrines the office with protection from the will of changes in government. As you may know, legislation would require a full vote in legislature. An advocate that's separate from the minister or arm's length allows the advocate to champion seniors issues without concern of what light it might shine on existing departments or government programs. It also needs to report on systemic issues without bias or influence, and they must be empowered to affect change and resolve issues for seniors. It needs to have the independence to report to the public without approval or editing by the government. And again, from Alberta, the previous Seniors Advocate, whose final report went to the Minister of Seniors and Housing and was not released to the public. It needs to have the stability and mandate and not subject to changes in focus of the ministers in power or the government in power. It should remain independent and have its own mandate. So this is just further on of how the reporting should be. So appointed as a part of the current ministry, which is what happened with Alberta, the legislated appointment which reports to a specific ministry, which is better, but still not the best solution. And what we really would like is it appointed by the Lieutenant Governor and report directly to the Legislative Assembly. And that way they have total autonomy on what they're going to do. What we're trying to communicate through this slide, and I think you heard some of that through Moses on the previous national webinar, is that the older adult is an ever-increasing portion of the population, and one that is very high percentage in voting. And what I've circled here is from 55 to 75 plus, you can see that that population votes more and has a bigger vote than any of the other groups. And it's not just that, you know, the demographic is increasing for the older adult, the lifespan is increasing as well. And the latest information from the United Nations is that life expectancy for people over 65 will increase by almost 3% by 2035 and 4 to 5% by 2046. In Alberta, 1 in 5 people will be 65 or over by 2046. There are no seniors advocates in any of the prairie provinces. Only BC, Newfoundland, and New Brunswick have provincial seniors advocate at this time. So for our provinces, seniors issues fall under another advocate or simply by the minister who has that seniors portfolio. Seniors issues are more than just health. In Alberta during 2016 and 17, when the Seniors Advocate Office was in place, 35% of the cases that they dealt with were healthcare related. Another 24% was for income and financial supports, and 23% was for housing and income supports, and 18% was from social supports. The last slide talked about how we're a growing sector of the population in each province. And finally, we've all heard the horror stories regarding long-term care in several provinces during COVID-19. It has also highlighted some of the other issues such as social isolation, food security, and other issues of concern to seniors. Now is a prime opportunity to push for a seniors advocate. As you can see, there's very little consistency between the provinces when it comes to advocates. Although Alberta has a total of 7 advocates, seniors don't have their own, and it comes under the health advocate. In Alberta, during the 3 years the advocate was in place, they addressed over 3,735 cases, far more cases than any of the other health-related advocates listed above. So in summary, support for establishing a legislated seniors advocate positions our province is growing. Seniors issues being handled under a health advocate or ministry is insufficient and doesn't have the breadth of a mandate that's required for seniors. Alberta had an effective seniors advocate put in place with the ministerial order and was not renewed. Manitoba has a minister of health who also has the responsibility of seniors, and Saskatchewan has a minister for seniors rolled under the Ministry of Rural Health and no dedicated staff or resources. So what can you do as individuals to help support our cause for getting a seniors advocate? Each of the chapters, the CARP chapters in the 3 provinces are going to be running their own campaign to establish a legislated seniors advocate office. So what we would be asking for you is to support this effort is to contact your local MLA and ask them to consider a legislated seniors advocate office. If you'd like to get involved in this campaign or learn more about CARP, you can contact one of the 3 people on this panel. Myself in Alberta, Kathleen in Regina, and Peter in Winnipeg. So I'm now going to turn the presentation back over to Kathy.
Thanks very much, Doug. There was a real depth of information there, and also thank you for the entertaining slides. What I'd like to do now is call upon the 3 provinces, one at a time, just give us an update on progress on the issues in their particular province. If we can start with Peter, then Kathleen, and back to Doug. So Peter, perhaps you would like to speak for a few moments.
Doug, I want to first of all begin by thanking you for the incredible effort you put in organizing the slide presentation and coordinating efforts between Alberta, Saskatchewan, and Manitoba. Manitoba has just got a newly formed chapter. It's chapter 47, which is primarily Winnipeg, but of course people from across the province are more than welcome to join. It was interesting for me to note that Moses spoke about 300,000 plus members of CARP nationally, when in Manitoba, I take a look at approximately 300,000 people in Manitoba alone that qualify as retired people or potential members of CARP. It just boggles my mind the lack of coordination and cooperation between various seniors groups. We have 43 associations in Manitoba that all theoretically lobby on behalf of seniors, but we can't seem to get together collectively to actually make our voices be heard and to present to the politicians the power of seniors' vote. So for reasons that I hope various people will get back to me, they know how to reach me. Some of them have my personal email, and of course you have seen Winnipeg at carp.ca as the CARP email address. We've just started reinvigorating the Manitoba chapter of CARP, and we hope that the momentum will build. We currently have in Manitoba, I believe, 1,900 CARP members. 1,600 of them are within the postal codes of Winnipeg. So if any of you have any questions, I'd be more than pleased to respond and interact with you. And I'm hoping some of these other associations, like Connie Newman and Brianna Gertzen and so on, are listening in on this, because I think we do have an opportunity to finally be heard as seniors. Thank you very much.
Thanks, Peter. It's certainly interesting to hear about Manitoba's reinvigoration. And, we have in Saskatchewan, we have a chapter in Regina, but not anywhere else in the rest of the province. So on that note, I'll hand over to Kathleen.
Thank you, Kathy. Well, for 4 years now, we've been running public forums with regards to what seniors need and want here in Saskatchewan. And what continued to bubble up to the top was a priority for a seniors advocate for our province. If anyone has ever needed information, run into a problem, or needed to access programs or services for older adults here in the province, they're only all too familiar with that sending you down a real rabbit hole. It can be an absolute nightmare trying to find and source the information that you need for when it comes to older adult issues and concerns. So it was, you know, why is this such an issue? We have a variety of programs and services, but no one is coordinating that, and no one is speaking on behalf of things when they don't work right. So a simple thing like trying to get a parent into a long-term care home can be an absolute nightmare for people, and it can take exhaustive amounts of time, weeks, months, and it's really challenging. So who do you call when you've got a situation of seniors abuse? No one knows. And we had a CARP member who ran into this exact problem in a rural area out on a farm. They were aware of a family member who was not being properly taken care of and was living in deplorable, actually horrid conditions, was dirty, was not being fed properly, and had been isolated from family and neighbors. They went to pretty much every organization in the province to seek help. It was horrendous how long they went at this, and they were blocked every which way you can imagine because of legalities, who has the authority to do what, and privacy issues because they weren't an immediate family member. And it was very frustrating to hear this and know that this went on for over a year before someone was actually able to get into that home and take this poor woman out of these conditions and, you know, and establish her in a proper long-term care home. We don't have anyone here to coordinate that effort. That is a systemic issue here, in that this can go on. I mean, this isn't an isolated incident. These things happen, and no one jumps on the bandwagon to sort out and find a solution for these types of situations so they don't happen again. I had a friend who at the age of 50 was diagnosed with early onset Alzheimer's. Okay, so she lost her job, she lost her driver's license, and she needed to apply for CPP, and she needed to apply for EI and long-term disability. She needed to fill out pension documents. She needed to do her income tax. She needed to get doctor's reports and fill out applications. And this woman had a diagnosis of early onset Alzheimer's. There was no one, absolutely no one, that we could find that would act on her behalf and help her navigate this system and all of the challenges that she was being faced with in face of this diagnosis. Now, fortunately for her, she had an army of friends who rallied around her, and we got her finally settled. But it is very, very disconcerting that this happens on a regular basis, and no one is looking at the systemic issues that are creating this massive issue for people in being unable to access services and programs. So a seniors advocate would do that for us. We need a one-stop shop for all things senior related. Someone to advocate for us when things go wrong. Someone to direct us to the right person, program, or service when we need something. Someone to stand up for us when our rights are being trampled on. Someone to advocate for low-income seniors. Someone to ensure there is a sufficient caregiver support out there. Someone who will address unique issues for our rural residents. A seniors advocate can do all of this and more. So we are working very hard in raising awareness about what a seniors advocate, an independent seniors advocate here in Saskatchewan can do for us. We're heading into an election, October 26th. And so this is a clear opportunity for people to talk to the campaigners when they're knocking on the door and when they're phoning and saying, okay, what is your party going to do for older adults here in Saskatchewan? Tell me what I can count on. If I give you my vote, what are you going to do for the older adults in Saskatchewan? And so I'll just leave it there. We're a big voting bloc. We hope that the politicians are listening and will step up and say what they will do to help us. Thank you.
Thank you, Kathleen. It's obviously something you've had a lot of experience with, sadly. And I find it disturbing that in that example of the person out in the rural area, there were people who cared, and yet it still took a year for the people who cared to be able to get this person some help. So if we can go back to Doug and let him talk about Alberta.
Sure. Well, thank you. And I guess one of the things I wanted to say, and following on with Peter's comment about other seniors organizations, CARP Calgary has been in place for quite a number of years, so we have already established some relationship with some of the other seniors organizations in Alberta. And what we're doing right now is seeking support from those organizations in our push for a seniors advocate in Alberta. And currently we have 8 of those senior organizations that have indicated interest. And we're looking at over 10 more that we're trying to get a hold of. And these organizations are from Lethbridge through Calgary, Red Deer, Edmonton, up to Fort McMurray. So we're trying to canvass the entire province of seniors organizations to get their support. I can echo some of Kathleen's comments as well about the need for a seniors advocate. I think the biggest issue that seniors face is not a lack of information, it's an overabundance of information that's available, and you don't know where to go to get what kind of support. And that's where a seniors advocate can help you get through the quagmire and get to the right place to get the right information and the right support. In Alberta, our ultimate goal will be to meet with the Minister of Seniors and Housing, and hopefully with the Premier himself, where we can outline this need for a seniors advocate and show the support that we're gaining within Alberta and Alberta seniors organizations for this to be put back in place.
Thanks very much, Doug. I think what I'll do now is just move on to the questions. Some were submitted before today and some have come up in the questions and answers. And then when we've kind of got through as many questions as we can before 1 o'clock, when I wind up, I'll go back to Kathleen, Peter and Doug and ask if there's anything they want to add based on the questions. So moving on, the first question here is actually addressed to Peter. What do you see as the top 3 benefits to having a dedicated seniors advocate in your province?
I think everybody needs an advocate. When I look at the a group of friends that I have canvassed, a number of them that don't have an advocate that is helping them push through the quagmire of our healthcare system, because they all refer you to yet a different government bureaucrat in a different department. There should be a centralized seniors advocate that you can approach the office and they will become your champion.
I don't know if Kathleen would like to add anything to that.
No, I think that I think that Peter had captured that. I think that a seniors advocate can be that one person who will lead us through the system that we can't now navigate by ourselves, because it is, as he said, it's a quagmire. It's very difficult to get through these programs. What is interesting is that the departments and the associations and organizations that provide programs and services for older adults, they don't talk to each other, we've discovered. And so there isn't any one person out there who knows all of the programs and services available. So we would rely on an advocate to be able to sort through that for us.
Thanks, Kathleen. So to Doug, what are the top 3 benefits to having a dedicated seniors advocate provincially?
I think, number one is that ability to champion seniors, individual seniors issues. I can tell you from personal experience with both parents and a brother in care, that the worst place you can be in Alberta healthcare is alone and without an advocate. But even a personal advocate doesn't have all the information nor the connections within the government to be able to find the right services. Another benefit of a seniors advocate would be to champion the systemic changes that need to happen in order for seniors to get the services that they need, and especially those seniors that don't have a personal advocate nearby. Lastly, I think it is important that the government hears from an independent advocate on what is really the issues facing seniors and what it can do to change that.
Thank you. So the next question is, when we continue to say how important and vulnerable seniors are, why do you feel provincial governments are so reluctant to establish senior advocate roles in our provinces? So if I could perhaps address that to Kathleen, first of all.
Well, I think that's a question we've all asked ourselves. What is it going to take to catch the government's attention, and why aren't they running with this? Are we less important? And I think that kind of pops into mind that as older adults, perhaps we are not as important as some of the other issues that they have on their plate. Are they worried that a seniors advocate would be a critic of the government and fear that it compelled them to have to do something on behalf of older adults? I don't know, it really is a puzzle, because a seniors advocate is a huge opportunity for government to find out what is not working out there, and to have someone propose to them what solutions will alleviate some of these problems and help us take better care of our elders. So I think that perhaps not understanding the full role of what an independent advocate would play and the benefit to the government would be, I think once they dig into that, I think that they would find that this would be a huge advantage, and an ace up their sleeve in trying to address and bring us to be a more senior-friendly province.
Perhaps if I can pass that to Peter in Manitoba.
I think the biggest fear the provincial government has is that by appointing a seniors advocate, they're opening Pandora's box. Right now, they're in a position and not just in Manitoba. But the Manitoba government's in a position where the fractured voice of seniors allows them to just respond to individual complaints or requests, knowing full well that they can say, oh, we'll look into it, or I'll have somebody address that, but never seeing the full force of what could be 300,000 members or people in Manitoba that would qualify or register for CARP. So as long as they can keep us fractured, they don't have to do anything. Once we would be united and we would be serious, they would have to deal with it. And that's why they celebrate the fact that we're fractured as seniors. By and large, I find seniors, we are willing to put up with a lot of things because we want to do the right thing for our country and for our province to our own detriment at times.
Thank you. So for Doug in Alberta, I've got a question in the Q&A from Ron, who's a retired engineer and a member of CARP in Alberta. And it kind of relates to what I just asked Kathleen and Peter. He's saying, why does Alberta not have a seniors advocate? So did it have one in the past? And do you have any idea why it went away?
Yes, to be honest, I can't really answer why we don't have one, because we did have one. And again, it was not in place by legislation. So simply what the government did is not renew the ministerial order. You know, Alberta's not shy of having advocates. As you can see, we have people with disabilities, a child advocate, a number of advocates. And while the seniors advocate was in place, they handled far more cases than any of the other health-related advocates, and they were running at half their budget. So, you know, the office that was in place was extremely efficient, extremely cost-effective, and it just wasn't renewed.
So that's kind of interesting, because we had a town hall in Saskatchewan where we had Dr. Suzanne Brake, who is a seniors advocate, I think, in Newfoundland. And her advice was actually to make it a legislated position, because if it's by ministerial order, they can just do away with it. So that perhaps what you just said there, they use that.
Yeah, that's why we're pushing to make sure that it comes in through legislation, and preferably appointed by the Lieutenant Governor.
Okay, so just looking at the other questions that are popping up, there's quite a few. There's some people volunteering, which is really nice. And Doug, you're in charge of the slides. So Alana says, please could you show the email addresses that you showed at the beginning, again at the end of the presentation. Someone's asking, where does the funding come from for a provincial seniors advocate? Is it funded by the provincial government? So I don't know if either of you three know the answer to that. Please just feel free to answer.
Yeah, for Alberta, it was the budget was given through the Alberta government, just like the other advocate offices. It's a budget item on the government budget.
Yes, that would be the same.
The same everywhere. Yeah.
Yep.
So next question would be, in the national presentation, it was mentioned that neglect is a form of ageism. Could you list 2 issues you would like a seniors advocate to address immediately if they were appointed? And perhaps if Peter would like to start off there.
Well, obviously one of the top priorities from my perspective would be a total review and changes to the long-term care facilities. Back in the 70s, we in Manitoba were faced with some changes that the government at the time forced us to change in personal care home management. At the time, I was on the board of one and I wasn't too happy, but in hindsight, I'm happy that they did, because that's one of the reasons Manitoba has dealt reasonably well with long-term care. But what I would also like them to really start focusing on is like the Danish model of healthcare in the broad context for people as they age to keep them out of nursing homes. So those are the two primary functions that I'm looking for.
And Kathleen?
Well, I think long-term care is on everyone's mind right now with regards to what has happened, what has become abundantly clear with COVID. But for a lot of us, we've known for a long time that there were issues in our long-term care programs and our models. So yeah, that's the one that jumps out at me that we need to pay attention to. Of course, there are those who are out in their home, and there's the matter of isolation for seniors. Transportation, particularly in the rural area, for older adults who may not have ready transportation. They may not have a car sitting in the driveway or be able to get themselves to doctor's appointments and things like that. That really puts them at a disadvantage that can ultimately have a huge impact on their health and well-being. So again, there's a lot of areas that we need to see some improvement on.
And Doug, two issues you'd like to see addressed immediately?
Just two?
Go for it.
Yeah, I think long-term care is certainly one of the primary ones. But, you know, social isolation and elder abuse are two other issues that are of great importance. And I think the pandemic has really highlighted some of that stuff. Social isolation because of the pandemic in nursing homes. I've heard stories already of cognitive decline just because they aren't getting any stimulus from being in a social atmosphere.
Okay. So I've got some questions here in the Q&A. So Peter in Manitoba, Dave Ennis, who's from Winnipeg, is saying, can we get the 2 advertising pieces that were shown in the national session so we can send them to others to encourage membership and to our MLA and MPs?
Absolutely. Please just send your contact information to Winnipeg at carp.ca, and rest assured I will get you that information.
And Laurie says, will a copy of the presentation be available after this session, or is there a link? A link.
So what
Am I understanding?
Yeah, so
sorry.
National is recording this presentation, and we will get a copy and post it on our respective Facebook pages.
So I think Doug, we have a volunteer here. Ron says, I'm interested in the campaign for Alberta.
Excellent.
Barry from Manitoba says to Peter, what were the reasons the previous Manitoba Chapter 47 folded? So perhaps that answer would be, Barry, if you would like to email Peter, you guys can talk about that.
Well, the answer I would give to that is it just aged out. The people that, it's a volunteer organization, and I think the ladies that had been doing it had done it for a number of years, and they just fatigued out.
Okay. Maureen is addressing this to Doug. Do you have any MLAs on board to support this push for a seniors advocate in Alberta? My MLA belongs to the NDP.
Yes, we actually have an MLA from the UCP that we are in discussions with to help guide us through the best way to approach the government on an issue like this for advocacy. So we do have at least one ally, and we actually are in contact with the Minister of Seniors and Housing as well.
So Leah, who I guess is in Alberta, asks, is there still an active CARP chapter in Edmonton?
Sorry to say, no, there is not. There has been an attempt a couple of times to try and get support for a chapter in Edmonton, but there was a chapter years ago, but there hasn't been any enough, I guess, interest in it expressed. I'm sure there's interest in it, but there hasn't been enough interest expressed.
So perhaps that's an opportunity if she's interested.
Absolutely.
So Wendy Johnson, who I know is in Saskatchewan, has said, do you see any benefit in our 3 provinces continuing to work together to achieve our common goal of reinstating or achieving a seniors advocate in our respective provinces? Kathleen?
Yes, I think there's an advantage there. First of all, we can pool our resources. We all have a similar mindset for what we're looking for. We do share, a geographic location, so we have similar issues, not identical, but quite similar issues. It saves us from having to recreate the wheel individually in each province for moving this agenda forward. So I think that there's an absolute benefit to that. We can reach out to our citizens and say, you know what, the biggest thing that you can do to help us right now is join us. Link arms with us, take out a CARP membership, help us build momentum and get that groundswell activity going to move this agenda forward in each of our provinces. And together we can, like even those advertisements that we saw with the national presentation, those are hard hitting and those are wonderful. We can share those kinds of resources amongst ourselves if we're all on the same page and working towards the same goal. So I think, yes, absolutely.
Does Peter have anything you'd like to say there?
Totally agree and support Kathleen's suggestions. I know Doug feels that way. We've been working together as a team for the past many weeks now and getting this presentation together. And I think it energizes each one of us to see that we're not alone and isolated in any given province.
And Doug?
You know, I echo the same thing. As both Peter and I have indicated, there is no lack of organizations that support seniors in any of our provinces. CARP Calgary did a scan about 3 years ago and found out just in Calgary there's 82 organizations that support seniors. So any way that we can work together, coalesce, and join forces to be a stronger voice and a stronger advocate is beneficial.
Did you just say 82?
Yes, 82.
Wow, 82.
Yeah. Well,
I know in Saskatchewan it's only 13.
Manitoba, I had done a summary and we reached 43, and I met with several groups and they said, oh, it'll be at least 80. So it's not just Alberta that's so messed up.
Right, just coordinating it really.
I think that people are asking how to take out a membership or direct their membership. It's quite simple. Go to carp.ca, select the chapter in your province, and click on that and take out a membership. It's only about $20, so take a look and join us.
So am I right in thinking that it's quite important to select the chapter you'd like to be associated with so that you get the appropriate communications?
The communications as well as the funding comes into the chapter. We operate on a shoestring. We're all volunteers, and the amount that we get from the memberships, it helps us along. It's a little bit to keep us going and help pay for some of our supplies that we need.
And the only way we get any of that money is if you actually select the chapter. If you join through carp.ca at the general level, the chapters don't get any of that.
Thank you. So we've got another 15 minutes and there's lots of questions popping up here, so I'll keep going. Some of them are kind of actual questions, they're information or rhetorical questions. So one is from Jim, and it's, why is it that there is a child's advocate? Children have not yet contributed to our society, yet there is no seniors advocate, and many have contributed much to our society. So I think that was talked about a little bit earlier around, it's a way of deflecting attention. If it's a fractured approach, the government can kind of ignore it. I don't know if anyone else wants to add anything to that.
Yeah, no, I don't want to pitch, seniors against any other group in the province. All I would say is that we want to get at least the same level of support that is offered to other groups.
I think that's a good point, and Barry here in the Q&A actually says perhaps what is the issue here is social justice. So like Doug says, it's across the board. So Brenda says, I think Michelle Rempel in Calgary is a prospective MLA to approach. Thank you very much for that. Alana, may we know the name of the UCP member who is supportive, Doug?
I'm not sure I want to share that at this time.
Okay. Wayne McCutcheon, St. Albert, Alberta, Board of Directors for St. Albert Seniors Association. Is there an opportunity for us as an association or individuals to support CARP?
Oh, absolutely. Supporting CARP by buying a membership is one way, but contacting us through the email address here. One of the things that we're trying to do more of nowadays is to build partnerships and working relationships with other groups that support seniors. So, like I said, we are going to have potentially up to 20 seniors organizations supporting this proposal for a seniors advocate. So we welcome any contact and any opportunity to work with similar minded organizations.
I'm sure that applies in the other provinces as well. So there's someone who doesn't give their name, but they say, Doug, I sent you an email. It went to a general CARP email account run by volunteers. So if that person would like to post another note here, we can help, or use the email there that next to Doug's name. Jacqueline says, please advise Doug that I'm on the CARP chapter executive with him. I have just received an email from Josephine Pond's office, our minister in charge of seniors and housing, saying that she doesn't have time presently to meet with us regarding our concern.
Yeah, well, again, we are still working on the support from the other organizations, and we're not quite ready to meet with the minister at this time. That's a future planned event. So
that's, I don't know, Kathleen, in Saskatchewan, when you've ever approached people, and Wendy, what kind of, was there any progress with that?
Approached people in what regard?
So that was a little bit of a rebuff from the minister. I don't know if you've approached ministers in Saskatchewan or Peter has in Manitoba and how that's gone.
The Minister for Seniors here in Saskatchewan, he and I have talked numerous times and stayed in contact with regards to seniors issues. Nice guy. He doesn't have the capacity to provide the services that we're looking for, that we would get with an independent seniors advocate, but certainly he is supportive of all of our initiatives and appreciates what we do in trying to mount the kind of support that we need to get some of the things changed. I mean, one person alone, even within a government, may not have as much power as one might think. An independent review and suggestion and proposal carries a lot of weight. Here in Saskatchewan, as I had said, we're going into an election. We have, we're presently, our government is the South Party. The NDP, which is the opposition party, yesterday we had heard this already, Dr. Miley, who was the leader of the opposition party, NDP party, spoke at a conference for Saskatchewan Seniors Mechanism. So there were a lot of seniors organizations in attendance, and he spoke at that. And he said that if elected, they would definitely give us an independent seniors advocate, and they would reintroduce standards of care, which was eliminated here in Saskatchewan quite a number of years ago. So there's no we do not have a standards of care. So what we're proposing is that we're looking to the South Party and we're saying, okay, well, this is what we're hearing over here on this side. What are you going to do? Are you going to match this? Because this is a huge ask, and there's a bubbling up of concern over us not having a seniors advocate. So what is the Sask Party going to offer us? Are they going to match what the other leading party is going to offer us, and help us make a decision on who we're going to vote for when we go to the polls? So put it out there. Tell us what your party platform is for all things senior related.
Does Peter have anything to add there about interactions the chapter's had with local ministers?
We've had some interactions with 4 different cabinet ministers. The premier in Manitoba is too busy, it would seem, for anything these days, and it's not just COVID related. We have a system in Manitoba called, we flip-flop between being run by the NDP or the Conservatives. The leader of the NDP party, Wab Canoe, has advised one of our board members, Carmen Edahan, that he is very anxious to meet, and as a party, they would certainly be very supportive of seniors advocate. What I will now do is I will make darn sure, working together with Carmen, to let the Conservatives know that this next election, the seniors will be vocal, and the seniors will want a seniors advocate and take this matter seriously. So God willing, it will actually become an election issue.
Thank you. So there's a question here from Maureen, and she says, pardon my ignorance, but is there a seniors advocate at the federal level? Kathleen?
A seniors advocate? No, we have a minister for seniors.
Okay.
So at the federal level, no, there is not.
But a minister is very different than an advocate. The minister just manages a department and a portfolio, but doesn't take on the responsibility of representing the very seniors that the department is talking about.
Thank you.
And I just want to say one thing. I think somebody brought up, the cost portion. The annual reports that the Alberta Seniors Advocate put out while they were in place, they were running at less than $500,000 a year. Now, they didn't have the resources, that didn't allow them to have the resources that they actually wanted to get everything that they wanted done. But just as an example, that's $500,000 a year.
I think in Manitoba, our children's advocate has a budget that exceeds $1.5 million because they also do investigations of inappropriate activities and so on. And I suspect that once there is a seniors advocate in place, you would have to staff it up where it would, the cost to the taxpayer would be, I believe, at least $1 million a year minimum.
So someone has said in the chat that Manitoba pays for resource coordinators by age and opportunity support services. Each part of Winnipeg has their own. So that's interesting to know. In the questions and answers, we've got Marion asking, do we have a template to shape our request for funding for a seniors advocate, required budget for an office, support staff, tenure, 3 or 5 year term, reporting and evaluating structure? So is CARP still at the call for an advocate stage, or has it been drilled down to a template? If anyone can answer that.
I think that's an interesting question. I heard the Seniors Advocate for BC speak yesterday at the conference, and what she indicated was that her budget, and she says they could always use more money, but her budget was based on services that she could provide. And she said, if you take that based on their population, it was a small amount in comparison to what they have for population in BC. Now, you take that same program or office portfolio, and you bring that to Saskatchewan or to Manitoba with much smaller population base, and you still are going to be looking at probably a significant administrative costs similar to BC, even though you have a smaller population base. So we don't need to recreate. We can go to the Seniors Advocate in Newfoundland and Labrador and borrow from them and take from them, and they will share with us whatever they are doing and what is working for them, equally as as Isabel McKenzie in BC is willing to do. They work together. They do talk to each other, these seniors advocates. So no, we wouldn't be starting from scratch, and we certainly can build on what they have already researched and built on.
Thank you. So there's a question here from Jerry addressed to Doug. What are the differences in senior organisations in Alberta that stand in the way of consolidating the provincial organisations into one stronger advocacy group?
Well, these are all independently created, I guess is what you would say. This is something that a seniors advocate could possibly be in their portfolio, is to try and consolidate, or not necessarily consolidate, but align these groups. Right now, we're doing that in Calgary, trying to work with the other major seniors organizations on alignment to the seniors advocate. But I don't think that seniors are alone in having a number of organizations that support them. There's other types of groups that have that, and it's just that there is no central place for them to come together.
This discussion's raising an interesting point. I'd just like to suggest, Doug and Kathleen, we should seriously at least consider the possibility of pulling together a proposal of what is a seniors advocate, what would their mandate be in our perfect world, and what would it take to fund that? Because right now, it's probably as a politician, it's a scary topic when we don't have a definition of what the cost would be and what the expectations would be. So it's something for us to discuss after this is all over.
It's a really good point. So what happens now is that people are making comments in chat and also in Q&A that relate to things we've talked about earlier. Just cover off a couple of those. Barry has said, standard of care is a quality of life and lives issue. And I'm sure we all agree with that. Someone else has pointed out, in terms of budget and cost for senior advocate, the Alberta budget for senior advocate was less than $1 a year per senior. There were 600,000 seniors in Alberta. So this really isn't a significant cost. It's cost probably isn't the objection. Someone else says, it needs to be said that a seniors advocate has to be non-partisan publicly. Carmen says, it would be absolutely critical to have a document ready to present to decision makers. So I think that's about having a template. So thank you, Carmen. The slide that you had, Doug, which was the Facebook pages, someone says, could you show that, please? It's a really good suggestion here from Murray. How about a CARP postcard advocating for a senior advocate that members sign and mail or hand to their MLA? So I think that's really helpful. People come up with ideas about that. So other suggestions, you could either use the email to your CARP chapter or go onto the Facebook page and get a bit of a conversation going and see if other people kind of have ideas like that. I like that idea, a postcard that people could sign and send in, and if it was bright and colourful, perhaps it could have some of those messages from the one page in Zoomer magazine that we were shown during the national. That would be quite shocking and would be a good message. So I'm just scrolling down now to have a look at other things. I think I've just about covered off all the questions. If anyone wants to ask anything or say anything, if they could do in the next few moments, please. I was kind of really interested with what Moses said about 300 members. Let's aim for 500,000, and with 1 million we take over the government. And I guess that is the message, that we're all going to be seniors at some time. So start pushing for change now. I love what I'm hearing here, the 3 provinces sharing ideas, and for us to encourage membership. So there is less of a fractured approach. There's power in numbers. So before we wind up today, I don't know if Kathleen, Peter or Doug, in that order, have a brief one-liner they'd like to add.
I would just encourage people to speak, share, and tell everyone as much as they can that we need a seniors advocate, and together we'll work towards that.
I think this has been a great experience for me, hopefully for those Manitoba members that were participating. I think CARP presents a wonderful opportunity for the broad spectrum of people, seniors, that there's no political affiliation or any other organization. It's just our mandate is pure and simple, representing seniors.
Doug, did you want to add anything to wind up?
Well, I guess I would just like to thank people who took time out of their busy schedule to attend this and listen and provide some great questions, and look forward to giving or having more information available for how to help out this cause.
So there's a number of comments here from people saying thank you very much to the panel for all your time and effort. And I know if we were in a room together, there would be a round of applause right now. So unfortunately, in this day and age, we're doing this remotely, so there isn't. So this is my round of applause to you. John is asking, do you know how many people tuned in today? I don't think that's a secret. What I see on my screen is 85. And usually we find when we do these sessions, it's 40 or 50 in Saskatchewan. So perhaps that gives you a bit of an idea. So with that last comment, what I'll do is just say thank you to everyone for joining us. Thank you for your comments in the Q&A and for the chat. So I've actually been told by CARP National, but at the peak we had 124 people. And so that's really good news. That's more than we would normally get on our own. And I think it's fair to say that we look forward to more sessions collaborating between the 3 provinces. And with that, I will just wind up the meeting. Thank you very much, everyone.
Thank you very much.
Thank you, everybody.